What's up? What's up? What's up? What's up? Hey, what's going on, Raleigh? Let me take a look here. Hello, Dr. Price. I had a quick question about applications. For the experiences section, how do we insert online experience does not have an address since that is a required Dropbox? You have to send me a screenshot of the exact spot that you're talking about. Usually there's some sort of an option. See if it'll let you free text it in there. I'm not 100% certain without seeing it because it changes just a little bit each year. But I'm happy to take a look at it if you can't figure it out. Sorry that that's not super terribly useful, but it's really helpful for questions about ERAS if you send me a screenshot of the exact area that you're struggling with. And then MF Rabbi said, tips on remembering glycogen storage disorders. So glycogen and lysosomal storage disorders are obviously super tough. So one thing that you can do is to study both of them in separate areas of your house. So for example, study the glycogen storage diseases at your kitchen table and study the lysosomal storage diseases in your bedroom or your bathroom or wherever. Somewhere that's totally different from where you studied your glycogen storage diseases. And so you start to build spatial awareness. And one thing that you can do to even further differentiate it, if you're just only struggling with the glycogen storage diseases, what you can actually do is to study each one in a separate chair of your house. So at your kitchen chair, study one. Number 2, go to your bedroom. Number 3, go to your bathroom. Number 4, study in your shower. Like, you can literally do that to help create memory hooks for yourself. And it sounds absolutely crazy, but it's something that I did all the time for stuff that was very easily confused. So for example, like ulcerative colitis and Crohn's, I would study one in the library and one at home. And that way that when I'm in the test, I just think back to where was I when I studied that specific thing. And that was super, super helpful for me. Obviously the memory hooks and mnemonics are always useful. But if you don't have a way to even recall the memory hook itself, then obviously you're kind of SOL, you're out of luck. So utilize your environment to your advantage. Create essentially a method of Loki. And so if you guys have studied the ancient Greek orators, what they did was they would envision themselves inside of their house or inside of their town. And while they're going through and telling a story, which obviously they could be up to multiple hours of length of time, these stories, because they're recounting basically all the history of the world, they would envision in their mind's eye that they were walking through their house and each item in their house stood for something in the story. And so that's how that they would be able to remember hours and hours of information and data points for their story all at the same time. And so you can basically invoke that yourself by either creating your own memory palace, your own method of Loki, or you can do what I was telling you with the spatial awareness in terms of where you're located at while you study. That way that you can have a way to hook onto that. So hopefully that helps. Another way you can do it is to study some by reading in first aid, and then others by doing flashcard, and then others by doing it on a whiteboard. And so you can split up the modality with each one of them. So don't study all of them in all 3 or 4 different modalities. Study specifically with one modality, each individual one. And so let's say you want to compare 5 disorders. What you would need to do the night before is to align out 5 different study methods. So number 1, like we said, whiteboard. Number 2, first aid. Number 3 could be quizzing with a friend. Number 4 could be taking notes. Number 5 could be an Anki flashcard. Number 6 could be reviewing old practice questions you've done on the topic. However you want to break it up. I mean, I just threw out 6 different study techniques right there. I mean, you could do it for 10 different diseases easily. So that's kind of a really useful technique, but where people go wrong is they start essentially mixing and matching the technique to the point where they're using the same technique for all the diseases. So if you just sit here and read first aid for all the diseases, you're not going to remember it because it all just starts to mash together in your mind. So that's why you really need to differentiate it somehow. And then on top of that, you can make it even more powerful by actually splitting up the techniques and splitting up the locations that you use the techniques. And so then it's even more compounded. And so as you see where I'm going with this, there's so many ways to really accelerate your retention of the material. You just have to be creative with it. And so that's why studying all the same way all the time at all times is not super beneficial for a lot of students, because then everything kind of just gets to be jumbled in your mind. You might know the differences if you're really put into the correct environment or the right scenario to recall it, but you might not be able to spontaneously or de novo recall that information. And that's like one of the trickiest things. Whenever you start getting into more and more disorders, you're going to see there's so many similarities between each of them, like especially with some of the glycogen and lysosomal storage diseases. A lot of them sound like a baby that gets weak for some reason, and so now you're just stuck. You're like, well, I remember that Krabbe had a baby that got weak, and then some of the leukoencephalopathies will have weakness, and then, oh shoot, did Gaucher have weakness? I can't remember. You know what I mean? So they really start to mash together in your mind if you're not careful. So hopefully that helps. I think that's where I would start with when trying to remember the glycogen storage diseases. All right, next comment. Nirali said, sounds good. I'll send you a screenshot when I get home. Okay, no problem at all. Feel free to drop any questions you guys have down in the chat. I'm happy to answer anything for you. You guys are wondering whether it's let's see, I've done 1, 2, 3, I've done 4 interviews for vascular surgery now, so got a couple more later this week. I think 3 left, so I'll probably do about 7 or 8 total. Just kind of seeing what's out there, seeing what opportunities there are, seeing what there is for different offers, whether it's financially, whether it's call schedule wise, whether it's benefits wise. There's a lot that goes into it, so it's kind of interesting to finally be on this side, to find a job like you do with the match process in residency, where you leave a lot up to chance. Now it's kind of more up to you rather than up to chance, how it feels like in the match. MF Rabbi said, thanks man, can you please share the story how you prepared for step 2 in short? Dude, there's a lot to it. It'd be very difficult to give it to you in short, but essentially how you prepare for your actual shelf exams will make a huge difference for your step 2 performance. You should not think of a shelf exam as any different level of knowledge than you will need on step 2. And a lot of people think like, oh, maybe the shelf is going to be harder, or maybe it's going to be easier. But if you study and you train on the shelves with the intention of absolutely obliterating the shelf exam, I'm talking like aiming for 90th percentile or higher, then you're going to at least have such an advantage of whether or not your school gives you a dedicated month for board prep. You're just super set in that regard, because you've already put in the groundwork that now when you're tying everything up and you're basically memorizing those last few details and starting to see everything cumulatively in terms of all organ systems, all shelf concepts, all disciplines of medicine combined, you've got such a good basis that it's not quite as hard. Whereas the thing that I see that students struggle with is if you go into your shelf exams and you pass each one by like 2 points, then even if you had 2 months of dedicated for step 2, which almost nobody has that, but even if you did, it just makes it so difficult. And so what I tell my students now is, if you want to take your time and go through this and basically learn all this material but at a very slow velocity, you can do it. I mean, anybody can do well with enough time. If you want to save time and basically cut your amount of studying down by, my old statistic used to be 43%, but I think that it's probably actually higher now. There's 2 things. Number 1 is the reverse pyramid protocol that I created a number of years ago now. It's about 5 or 6 years ago. And then number 2 are the secret archives. The secret archives are the content that I've put together to make your shelf exams and your step 2 and your step 3 infinitely easier. I cover the 70 plus highest yield concepts in there, break down every single derivation of basically how you can be asked those concepts, and teach you memory hooks as well as the information to make it easy to recall. I mean, after doing this now, I've worked with over 2,000 students. Obviously, I see stuff that shows up every year, see stuff that has certain algorithmic permutations of how they ask these questions. And it's very, very clear at this point what they're looking for. So I just try to make it as easy as humanly possible for you guys. All right, next, Be the Queen wrote, tips on personal statements and how to start it. Great question. So with personal statements, I want you to kind of build the framework before you dive into it. And so obviously you need to know that it's one page only. So you don't need to type any more or any less than that. And you want to start thinking, what kind of structure of my 3 to 5 paragraphs will I have? So obviously, in most simplest terms, you have intro, body, conclusion. Okay, cool, that's easy enough. And then you start thinking, well, within the intro, what are some of the things that I can include? Well, you can include your path to medicine, your journey, some of your backstory, some of your history, those kind of things. Some people like to lead with a really interesting story. And so if you have a interesting hook of why you got into medicine originally, then you can put that in your intro, and that's perfect. And second paragraph is where I start to really include personal anecdotes that you have witnessed in the medical field that really tied you to the field you're going to. And so, for example, if there's an anonymous patient story that you'd like to discuss that you feel really resonated with you, then I like to include that most preferably in the second paragraph. And I think it's really useful there because at that point, they know a little bit about you and your motivations and your passion for medicine, that having the personalization in the second paragraph really is going to keep the reader going into your conclusion. And then in your conclusion, you talk about what your future goals are, your passion for the field in the long term, what you see as a vision, where you can basically see yourself in the next 3 to 10 years. So if you're only applying for academic positions, then you could say that in your final paragraph, like, my goal and my passion is XYZ because I want to fulfill that at an academic position where I'm going to be able to teach the future generations of medical professionals, etc. Something like that. If you're applying for only community programs, then you would obviously have a different story than that. So I think the third paragraph, it's best to include kind of your conclusion as well as your aspirations for the future. And that's how I break it up, is 3 paragraphs. If you need an extra 1 or 2 paragraphs, that's fine, but I wouldn't do any more than 5. I'd say that's the max, just because it's hard to fit reasonable sized paragraphs into 1 page if you have any more than 5. But that's kind of like the general overarching framework. If you have that down, then you just got to ask yourself the questions that I just presented to you. And then I highly recommend sleeping on it. Give it 2 or 3 days and then revisit it. You don't have to finish your whole thing in one sitting. And the easiest way with your personal statement, this is something that I did that I feel every single med student should do, is just take notes when you're on rotations of stuff that you absolutely loved. Because when you're essentially on the job and running around seeing a million patients, you're going to forget stuff down the road. You're going to forget what it was exactly that a patient said to you that really brought you to tears or really connected with you. And so just write these things down, because even though you feel you'll remember it a month, 2 months, 6 months down the road, it's very likely that you see so many patients since then that it's difficult to recall that exact experience with good, vivid detail. So just take notes as you go down through your rotations and while you're on the wards, because it'll pay off in dividends whenever you have to sit down and write all this down. Like whenever I did this, whenever I went to write my personal statement, I had so much of it already written in my notepad just from ideas that I had kind of spontaneously written down while I was in the middle of my rotations, walking from one patient's room to the next, that I kind of reaffirmed throughout the day. Why do I want to do vascular surgery? Okay, XYZ experience I just had, boom, that falls right in line with that. That basically personifies why I wanted to go into this field. Tied it into being a CNA. That was like my first exposure to elderly patients in a nursing home. I worked for like almost 6 years as a certified nurse aide. And I tied my passion for surgery to my passion for elderly care, and that brought me to vascular surgery. And so if you think about your personal story, you think about the things that have made you into you, then you're going to be set with your personal statement. But definitely, all in all, for the things that I just said, the most important parts are, number one, you want to take notes while you're on rotations. Number two, build the structure of your personal statement using some of those questions that I just gave you. And then number three, don't be afraid to sleep on it. It's very, very difficult to finish the whole thing all at once in one sitting. It's a lot of pressure to put on yourself. So you don't have to do that. Try to bang out one paragraph in a weekend, then go back to it. Makes it much, much easier that way. Let's see, we got a couple more questions. Good question, be the queen. Chris Paul 2512 said, given your test for step 1 being pass fail, would you say priority has shifted to step 2? And this is Christian from the Secret Archives. Hey, what's up, Christian? How's it going, man? Oh, dude, 100%, 100,000%. The focus on step 2 has been evident since about 2019 or so, maybe even 2018. So the thing that I noticed was back whenever I was in med school, actually step 1 was still scored at that point. And so even when I went on to interviews, the program directors, they weren't even asking about step 1 performance. And this is before when step 1 actually was scored. They already knew that the step 2 is becoming the emphasis, because at the end of the day, step 2 is the stuff you use every day as a resident physician. It's the actual knowledge that's useful for you. Whereas step 1, I mean, you're not talking about eye cell disease and the biochem pathways ever again, literally ever again once you get out of med school. And I guess that's not true since I just talked about them right now, but you're not going to be talking about that stuff with your patients unless you're a high-level geneticist at a huge institution where maybe you'll see one case of eye cell disease in your whole career. I don't know. But I say that to say, like, you're not going to use that information from step 1 nearly as much as you'll use the stuff from step 2 and step 3. And step 2 and step 3, they really, really similar level content. In fact, I tell a lot of my students that if they're given the opportunity to take step 3 before they start residency, or maybe even within the first month of residency, that's when you want to do it. Get it knocked out when the information is still fresh in your mind, because you'll be amazed by how many other obligations that you have throughout your time in the hospital that your studying just goes by the wayside on certain months. So for example, like our transplant month is really horrendous in terms of hours. I mean, you could be up all night in a row for like 3-4 nights in a row, operating in different states actually, because you fly out to get organ procurements, you bring them back to the recipients, and it's very, very time intensive. And that's also kind of how some of our vascular surgery rotations are. Whenever you're the chief of the service, you basically could be operating all night, multiple nights in a row. Like I had knee surgery on Tuesday, so about a little over a week ago now, and of the next 7 days I was on call for 5 days, and for those 5 days, 3 of those 5 days I was operating until 4 a.m. and then still had to work the next day. So on days like that, you obviously don't have time to study. It's just physically impossible. You barely have time to eat or sleep. So get step 3 done with as soon as you can. Use the Secret Archives for it. It will make your life infinitely easier. It's meant to save you guys the hassle and save you guys the headache that everybody else has to deal with, essentially. That's why I created it. All right. Next question. Be the Queen said, how do I talk about every rotation and how it impacted me in one page? Well, the thing is you absolutely do not have to talk about every rotation. In fact, I don't recommend talking about any rotations that were not within your specialty. So for example, even though I apply for vascular surgery, there'd be no point in me talking about my psychiatric or OBGYN rotations in my personal statement. You don't want your personal statement reader to be confused about what specialty you're applying for. If you're applying for surgery, for example, and your entire personal statement is about your internal medicine rotation and how you love your internal medicine pathologies and patient population, and while all that may be true, that's not the time or the place to discuss that. If they ask you at your interview, hey, did you like internal medicine? It seems here that you did really good, you had a high pass, or you honored the rotation. Sure, you can talk about it, but in your personal statement, it should be exclusively about what your passions are in the field that you're applying for. So keep that in mind. All right, next question is Senorita Bonita says, hey, what's up? Any other questions you guys have, drop them in the chat. I got you. I'm in like bumper to bumper traffic here, trying to get to my next interview dinner. Heading up to West Palm Beach. Let me check my GPS here. What can I do for you guys? Drop any questions down below. All right, Chris Paul 2512 said, besides Secret Archives, what's your recommendations for step 3 resources? Dude, don't use a single thing besides Secret Archives and UWorld. That and your practice assessments and you're good to go. You need absolutely nothing else. In fact, it's almost a waste of time for you to use other resources, to be honest with you. Obviously, I'm biased, but it's just, it is what it is, man. I would not use a singular other resource. Chris Paul 2512, he said, okay, thanks. Yeah, man, absolutely. What other questions do you have? Now's your guys' chance. Anything that you've ever wondered about the process, you've been too worried to ask someone, or you didn't have good advice on it, or anything that you've been concerned about, now's the time to type it out and let me know, and I'll walk you through it. All right, Norelli said, hey, just had a general question about how to gauge how auditions are going. I try to always ask for feedback, but sometimes it's really general and I feel confused as to how I am doing. All right, so I think that there's a few things you can do to help with that. Number one, I always recommend students to get mid-rotation feedback. And so there's two ways you can go about it. You can ask the residents or you can ask the attendings. And so both are useful. Obviously, both will have different levels and types of insights into your day-to-day performance. But overall, it will also show your squad that you're working with that you actually want to improve and that you're the type of person that is going to take constructive feedback and become better because of it. So that's one of the best things about asking for feedback. Number two, if the feedback is generic, instead of asking for a sit-down feedback session, which can be difficult for some people, like maybe some of the residents don't feel comfortable doing it, or maybe your attending's kind of shy and doesn't like doing direct feedback one-on-one like that. Who knows? I mean, everybody's different, and I totally get that. So what you can do is ask them, be like, okay, I noticed that you do something this way. Would you rather I change how I'm doing it? So ask them kind of like almost questions that show you're being perceptive, but also they give the person almost a lead-in on points to comment about. Like, hey, I noticed with rounds that you do this. Do you like it better whenever your students do X or Y? Or in the operating room, you could say, hey, I've been trying to close the skin this way. Is there a way that I could be doing it better? Or something like that. But basically ask them a direct question about one of your skill sets rather than saying, hey, how am I doing? And so that makes it a lot easier to give feedback. If they don't like how you're closing skin, they'll tell you. They're like, oh no, I think that your skin closure is incredible, or I think that has a lot to be desired. And so I think the best thing you can do is to show you're motivated to learn, show you're actually caring about doing a good job, and the feedback will come. And so don't be shy. Obviously it's difficult, I know, especially as a med student, because you always feel like you're kind of at a disadvantage in those type of scenarios. But this is something that just you got to get used to, because even in residency you ask your attendings for feedback, and it just comes with the territory. All right, next question from Safi Katab. She said, step 2 in 2 weeks. NBME score aren't where I'd like them to be. Last minute advice to boost my score. Secret Archives. If you haven't been through the Secret Archives, it is 100% worth it. I've had students go up 10 to 15 points in 1 week off of just going through the Secret Archives and not even doing a singular other resource or question. So obviously the more times you go through the Secret Archives, the better, and the more time you spend really using the Fibonacci learning acceleration, obviously you're going to perform better in that regard. But even with one singular pass through, I've seen students going up 10 to 15 points. So definitely check that out. It's on our page. You can find the link, and it's 100% worth it if you have 2 weeks to go and you need to jump your score. I would say I wouldn't do a singular other practice test until you've been through it. You can get through it in less than a week if you really, really hustle, and it will definitely put your score up at least into the 10 to 15 point higher range if you apply the stuff that you've learned. Safi said, thank you. Yeah, absolutely no problem. All right. Got another question here. Let me check my GPS real quick, make sure I'm still on track. Dr. Anime said, let's see. Hi, non-US IMG here, step 1 in December. Trying to study while juggling coursework is hard. I dedicate about 8 hours a day to STEP, however I sleep for only about 4 hours. How can I be more optimal? I would need to know what you're doing throughout the day to help you make it more optimal. I'll tell you one thing, is if you're sleeping 4 hours a day, you will never beat somebody that is able to sleep 6 to 8 hours. It's just almost impossible, because your long-term retention will take such a hit. And that's the biggest problem, is LTR goes down, the more your sleep goes down. So if you sleep 4 hours, maybe you'll retain 50% of what you studied that day, whereas somebody that slept 7 hours, maybe they'll retain 75% of what they studied that day, at least until tomorrow. But then it compounds over time, because if you're studying 50% retention day after day after day, you're just never going to beat somebody that rides at about 75 to 85% retention. And so it's kind of a losing battle. So a couple of things that you can do is you can look at the 80-20 of what you're doing right now and cut out 80% of the stuff that is not really benefiting you. So if you're trying to prep for STEP, obviously questions are critical, obviously. And so those are part of the 20%, the 20% most important. Maybe you are going through super long lectures that your teachers provided. That's probably part of the 80%, because it's not super useful or applicable towards your USMLE. So you just have to look at every task you do during the day and break it down into the 80-20. All right, International Imagination Station said, love your tweets, Dr. Price. Hey, good to see you, Mohammed. Glad to have you on here. All right. Tariq Nasir said, what's up, AP? Got my exam on the 18th. Hey, sorry, guys. Tough question without a little bit more information. basics for sure. You've done the NBMEs, the free 120 basics for sure. You've done the NBMEs, the free 120, and most CMSs. Have you completed UWorld? Have you completed the Secret Archives? That's really my next two big questions. And it depends on how many points you want your score to jump. Like, if you're happy with where you're at, cool, keep doing what you're doing, man. If you need to jump your score another 10 to 20 points, then we got to make some changes. All right, let's see. Dr. Anime said, okay, I have classes from 9 to 3. That's why I will apply the 80-20 rule. Thank you so much. I love your tweets. Yeah, absolutely. Happy to have you on here. I know that it's difficult for sure to balance your coursework with your studying, but it'll pay off. It always does. Judith Januario said, hi, Dr. Price. I updated my personal statement and would like your feedback. How many programs should non-US IMGs apply to? Best website for program search in your opinion? All right, so in terms of programs, that's more of a financial question, to be completely honest with you. So you have to look at your competitiveness and then see what you can reasonably afford financially. And so the reason I say that is, let's just say you're applying for general surgery, for example. If you're not at or above the average match score for general surgery, then you're gonna have to apply for a lot more positions. You might have to apply for all 303 positions, compared to somebody that beat the score by 10 or 15 points, they're scoring in the 260s, then maybe they only need to apply for 70 positions or 50. But if you're at or below the score requirement that is required for your specialty, you have to apply very, very broadly. And do not be afraid of applying to a wide breadth of programs. You never know which ones will give you interviews, and it also depends on the amount of signals that your specialty has. So generally, the more signals you have, just the lower signals you have, is going to programs that you apply to consider the signals. So for example, if you're applying to a specialty that only has 5 signals, those 5 signals are so valuable because they know that out of all the places in the country, you spent one of your 5 signals at their program. Whereas if you're applying with a specialty that has 30 signals, sure, they still think it's important, but it shows less dedication to that specific program than a program that has less signals. So it's kind of just a balancing act. And then best website for program search in your opinion. Okay, so program search, I really like Frida. It's the one that's kind of tried and true, and I've used it myself many, many times over the years. It's FREIDA. Don't take all the information on there as absolutely perfect. Take it with a grain of salt, but it does have, from my experience, the best database of up-to-date information of how to contact the program directors and the program coordinators. So that's the website that I primarily use. It's the one that I have a lot of my mentees use. I think that it's really useful because if you have a question, you can literally just look on there, find the program coordinator's information, and fire off a quick email or give them a call. So that's the way to do it. Tariq says, knocked out UWorld, Secret Archive, what are those? Dude, you gotta check the Secret Archives out. They're the program that I essentially put together to save med students a massive headache on their board prep. People generally go up in their scores 10 to 15 points with just a singular pass through of it. So you certainly have enough time to run a pass through it, and it will definitely pay off dividends in terms of your score trajectory. So check it out. If you followed me on Twitter, if you follow me on Instagram or anything like that, or seen any of my old review videos on YouTube, then you kind of know what they're about. These are the whole next level of that. So Tariq says, TBH, the average score I'm at right now is 255. Boosting it up would definitely be nice, of course. Yeah, Secret Archives for sure then for you. Staying off the grid, you can get blocked. drop any other questions you guys have here. Happy to help. Tariq said, thanks, brother. I appreciate you. Yeah, man. Absolutely. Happy to help. Happy to be here. We'll call it a day right here. I appreciate you guys for hopping on. Let me know if you need anything, and we will talk soon.